One, my name is Dr. Muhammad Noor, consultant embryologist, anatomist, and histologist. Today, our session about the thyroid gland. Thyroid located in the neck, location located in the neck. It has two loops, two lateral loops, and sometimes pyramidal loops related to larynx, trachea, recurrent laryngeal nerve, parathyroid glands that are situated posterior to the thyroid. Blood supply by the superior thyroid artery or inferior thyroid artery and thyroid artery. What are the objectives? My objective is to describe the shape, pyramidal shape, position, relation, and structure of the thyroid gland. List the blood supply, lymphatic drainage, and of course an innervation. List the nerve in danger with thyroidectomy when you take the thyroid. Thyroidectomy, taking the thyroid outside, surgical removal of the thyroid is called thyroidectomy. Describe the shape, position, blood supply, lymphatic of the parathyroid glands. Describe the development of the thyroid and parathyroid glands. This later on we're going to discuss it in another session, along with the common congenital anomalies of the thyroid. But before we start to talk about the thyroid, we have to talk about the deep fascia or deep cervical fascia of the neck, which is divided into investing layer, pre-tracheal layer, and pre-vertebral layer. As you can see in the picture, take a look to the pictures. Thyroid gland is a single gland, is a bilobe, two loops generally, in the neck, largest in all endocrine, and is the first endocrine gland to develop, produce hormones T3 and T4. It is a unique among the human endocrine glands that is store large amount of inactive hormones within the extracellular follicles. Brown, red, and soft during life, usual weight 25 to 30 grams. It is larger in women, surrounded by a thin fibrous capsule of connective tissue. External to this capsule is a false capsule formed by pretracheal fascia. Take a look to two loops which are connected by isthmus, which extend across the trachea anterior to the second and third tracheal cartilage. In some people, about 20 to 40% pyramidal loop exists ascending from the isthmus towards the hyoid bone. The hyoid bone is at level of C3. Shaped like a butterfly once again. Overlies the second and third and fourth tracheal rings, surrounded by facial sheaths derived from the pretracheal layer of the deep fascia. It's surrounded by the pretracheal, pre means in front of the trachea, which is a part of the deep cervical fascia, which I did mention. Each loop is a pear shape with apex reach up to the oblique line of the thyroid cartilage. The length of the lobe is equal about 5 centimeters in length. Its base lies at the level of the fourth and fifth tracheal rings. Inside the pretracheal fascia capsule, there is another capsule. So it is surrounded by two membranes. Here, as you can see, once again, weight about 20, 25, 30 grams. The follicle is a functional part of the thyroid. It is full with colloid, which is the glycoproteins, thyroglobulins, covered by plastic stroma. There's stroma. Stroma means covering. And the parenchyma, you have to differentiate between, to define the stroma and the parenchyma. Stroma covering or protective sheath, and parenchyma is the functional cells. Stroma is a true connective tissue capsule. Take a look to the thyroid gland, to the base, to the apex, to the capsule of pretracheal fascia. Take a look to the capsule of the gland, lobe of the thyroid gland. Take a look to the isthmus. Take a look. As I did mention, the pyramidal lobe is connected to the hyoid bone by a fibrous muscular band called levator glanduli thyroidi. What are the relations of the thyroid? Anterolaterally, 4S, sternothyroid muscle from the sternum to the thyroid gland, sternohyoid from the sternum to the hyoid bone, superior belly of omohyoid, and sternomastoid, as you can see in the pictures. See these pictures? See superficial, see the carotid sheath in the neck, see the investing prevertebral fascia, see the pretracheal fascia. These are part of the deep cervical fascia. Posteriorly, carotid sheath and its contents. Medially, above larynx and pharynx, below trachea and esophagus. Recurrent laryngeal nerve in between the trachea and esophagus. The recurrent laryngeal nerve, the nerve that branches from the vagus nerve. Recurrent means goes back. Cricothyroid muscle and external laryngeal nerve. The external laryngeal nerve is the branch from the superior laryngeal nerve. The superior laryngeal nerve gives internal laryngeal nerve and external laryngeal nerve. The superior laryngeal nerve is the branch from the vagus nerve. The vagus is the 10th cranial nerve. The posterior border is related to superior and inferior parathyroid glands. It is also related to anosmosis between the superior and inferior thyroid arteries, as you can see. Take a look to this picture. Have a look. Thyrocervical trunk branch from the subclavian artery. It gives the inferior thyroid artery. And the superior thyroid artery is a branch from the external carotid artery, as you can see here. Superior thyroid branch from the external carotid artery. It descends to the upper pole of the lobe with the external laryngeal nerve. Here, this is an important clinical relationship. Also, the thyroid artery also sometimes supplied the thyroid gland and the inferior thyroid. 3 branches, 3 arteries that supply the thyroid: superior thyroid artery, inferior thyroid artery, and thyroid artery, as you can see. The veins of the thyroid gland, superior thyroid vein, drain into internal jugular vein. The middle thyroid vein drain into internal jugular vein as well, and the inferior thyroid vein drain to the left brachiocephalic vein. As you can see here in the picture, internal jugular vein and the subclavian vein, they unite together and form the brachiocephalic vein. The 2 brachiocephalic veins unite together and form superior vena cava. See, take a look to the histology of the thyroid gland. Take a look to thyroid follicles. These are functional cells. It's lined by simple cuboidal epithelium, sometimes columnar epithelium, colloid, which is the glycoproteins, thyroglobulins. Take a look to parafollicular cells that secrete calcitonin. The parathyroid glands are 4 small ovoid bodies about 6 millimeters long, very small. They lie within the facial capsule of the gland, of the thyroid gland, between the two membranes. The superior parathyroid has a constant position in the middle of the posterior border of the gland. The inferior parathyroid usually at the level of the inferior poles. They lie within the thyroid tissue or sometimes outside. The parathyroid gland, as you can see, they are supplied by the superior and inferior thyroid artery. The veins drain to the superior, middle, and inferior thyroid veins, and the lymph deep cervical, and the lymph drain to the deep cervical and paratracheal lymph nodes. The nerve supplies superior and middle cervical sympathetic. Here, the clinical, here, see, I can look to the clinical notes. The external radial nerve runs close to the superior thyroid artery before turning medially to supply the cricothyroid muscle. All the muscles of the larynx are supplied by the recurrent laryngeal nerve, except the cricothyroid. The cricothyroid muscle is supplied by external laryngeal nerve. High ligation of the superior thyroid artery during thyroidectomy. Thyroidectomy means removing of the thyroid, places this nerve at risk of injury. So it should be ligated within the upper pole of the gland, and its region will cause hoarseness of the voice. The inferior thyroid artery is closely related with the recurrent laryngeal nerve. This can be found in a triangle bounded laterally by the common carotid artery, medially by the trachea, and superior by the thyroid lobe. The relationship of the recurrent laryngeal nerve and the inferior thyroid artery is highly variable, in that the nerve can be lie deep or superficial to the artery, or between the branches of the artery, and be different on either side of the neck, right side and left side. Consideration of this nerve and its branches must be taken into account in thyroidectomy. You have to know this. Sometimes it will be superficial, sometimes deep, sometimes in between. The hypothyroidism, lack of secretion of the thyroid hormones. What are the clinical signs? Skin and tissue disorders, mixed edema, this is edema, puffy face, weight gain, hair loss, increased tissue around the eyes, lethargy, intellectual and motor slowing, cold intolerance, you cannot tolerate the cold, constipations, deep husky voice. What are the causes of the hypothyroidism? Primary thyroid hormone failure, secondary disease of the hypothalamus or pituitary gland. Treatments, synthetic thyroid hormone can reverse the condition. You could be normal, can reverse the position. Take a look to this. Thyrotoxicosis or hyperthyroidism is oversecretion of the thyroid hormones. Clinical signs: dramatic increase in metabolic rate, weight loss, increased appetite. Despite increased appetite, you have weight loss. Nerve energy, nervousness, tremor, excessive sweating, heat intolerance, cardiac palpitations, exophthalmos, protruding of the eyes to the outside, as you can see, exo to the outside, exophthalmos, causes abnormal hormone secretion, internal gland out of control, localized new blood caused by overproduction of the hormones, and Graves' disease. Take a look at unilateral swelling, thyroid gland unilateral swelling, goiter. Swelling is called goiter swelling, as you can see in this picture. Enlarged thyroid gland. What are the indications for sonographic examination or ultrasound? Palpable enlargement thyroid, abnormal thyroid hormone, palpable mass in the neck, thyroid, swelling of the neck, asymmetry, they are not the same both sides, asymmetry, redness or tenderness. As you can see, these are the technique of the sonography or ultrasound. Take a look and have the idea of this patient supine with neck extended. Supine means face up. You extend the neck and you put the probe. Test yourself, which is the following nerve is in danger in ligation of the superior thyroid artery. External laryngeal, recurrent, internal laryngeal, superior laryngeal, which is the following structure lies anterior to the thyroid lobe. Tear relations. Inferior belly of omohyoid, internal jugular vein, vagus nerve, sternohyoid. Okay, that's all I got to tell you. Thank you very much.